Thank you for tuning back in with us here at the Breathing and Sleep Center. I know we've gone over a lot of information already before, but a lot of what people come in here for is with symptoms that they want to address, things that they've had issues for either, for a shorter period of time or maybe even a lifelong struggle with certain symptoms. Things that can be a little bit more benign, like mouth breathing and crooked teeth, swollen adenoids and tonsils, to things that might be a little bit more serious, like depression, anxiety, high blood pressure, to then things that are even more serious, like cardiovascular disease and strokes and heart attacks. So we are here because we're going to review some of the things that we can actually address, some possible root causes that could be leading down this road of a lifetime of illness, possibly.
There is a silent crisis going on right now in our world, and a lot of people don't know that the root cause often has to do with the underdevelopment of the facial structures. So we have a really unique way to diagnose and evaluate a patient to see who is appropriate for treatment, and it can be a very life-changing treatment and lead to some really exciting outcomes for kids and adults.
So stemming off of that, we can start to see signs as early as, even like right when someone's just after birth.
Sure.
But even with kids that we normally see, ages 3, 4, 5, all the way up to 10, you start to see signs early on. And even though these kids look like normal kids or, common presentation of kids, you start to see signs early on, like a double chin or the lip is starting to protrude out. You start to see bags under the eyes on these kids, dimpling of their chin. There's a lot of signs that we can see early on, chapped lips, that can be a sign that they're already starting to struggle this early in life. And it's not something that's just going to cure itself. And those are usually the ones, if we can intervene early, we can stop that lifetime of suffering and progression of those illnesses.
And in combination with that, that's also a really good time to also start evaluating some of the symptoms of this. And this can be everything from bedwetting, into, ages 5, 6, 7, 8 years old, even later. It can be, the classic ADD, ADHD. It can be problems with sleeping, the chronic night terrors, anything like that. So a lot of things will go hand in hand with the signs that we're seeing clinically, as well as the symptoms that parents are dealing with, that teachers are dealing with as well.
I think one of the most obvious, signs that we see in children are crooked teeth. That's such an easy thing as a parent to look at, and as you start to see that develop, that's a problem. Something is wrong with that child. They are not able to swallow or breathe correctly. And so crooked teeth is such an easy thing for parents to look at. Asthma, allergies are some of the other big symptoms that we see in these kids. And the earlier we can intervene, the better.
And if they have issues with speech, or if you're having a concern about possible tongue ties, if there's ever issues with breastfeeding early on, that maybe you weren't able to breastfeed as long as you wanted, and if you've ever had to go to an ENT specialist and they started looking into your tonsils and adenoids and getting those out, early intervention can possibly reduce the need for those more invasive procedures. So when we actually look at the symptoms that people are coming in with, a lot of these symptoms are just that. These are downstream effects of something more serious that's going on. These are the branches and the leaves on the tree. It's just the very superficial observations that you see, just like the hypertensions and the bedwetting, when there's really more of an underlying cause, such as a compromised airway. And if you have a compromised airway, it's going to be hard to get the proper amount of oxygen, and that's the one thing we need in life to survive is oxygen. You can go 2 weeks without food, 2 days without water, and maybe 2 minutes without oxygen. And so if you have compromised oxygen levels because of a compromised airway, that's where a lot of these downstream effects happen. And what kind of goes off of that, compromised airway, like Dr. Erlander was saying, is those crooked teeth. If you have an underdeveloped jaw, you're not going to have room for teeth, and then you're also going to create an underdeveloped airway. And so that's essentially what we're addressing, is those underdeveloped jaws, those underdeveloped airways and growing those to essentially make it so you're breathing out of a garden hose instead of a coffee straw.
This is something that starts, as early as when you're an infant. So, this is a story we're going to tell. We're about to get into that story a little deeper, but basically with the lack of developing the muscles, that are involved with nursing, involved with eating food that is hard and requires muscle and chewing. Without the muscles there to stimulate the bony growth, the jaw's underdeveloped, and then it leads to crooked teeth, and behind those structures is where the airway is. And so, the down long-term effect of that is an obstructed airway, and these children don't have enough room to breathe. They did not develop the muscles correctly to form the face.
I always tell the patients, there's a battle between muscle and bone. What's going to win? And the muscle's going to win. Bones are there because the form follows their function. And if their function has been compromised, their form will be compromised. And everything we see is completely downstream for that compromised function and the compromised form.
The crazy thing is most of this development actually happens really early in life. It's about from the time you're born until about 4 years old. So we're talking about our craniofacial growth and the development of our jaws. We're about 75% developed in terms of that growth by the time we're 4 years old. So it happens early on, and a lot of it happens, it's kind of our Western society's habits with, maybe more limited breastfeeding and processed foods like Gerber foods and whatnot. That's not helping stimulate that muscle and that bony growth.
Yeah.
We used to not need orthodontists and oral surgeons because when we look at the human skull 400 years ago, they had perfectly aligned teeth, all 32 of them, including the wisdom teeth, and they're pretty much perfect function. And there was no such thing as an orthodontist or an oral surgeon back then. I mean, obviously both of those professions have a big role in treatment, but back 400 years ago, we didn't need them to straighten teeth because you had that properly developed jaw. Whereas nowadays, we don't have enough space for that, and so we're having to take out wisdom teeth. We have taking out premolars to try to create enough space to create the appearance of straight teeth, when it was really the reason why we have those crooked teeth in the first place is because of those underdeveloped jaws.
It's also, there's parts of the world where this is not a problem. So there are parts of modern day where people are developing without crooked teeth. They don't have orthodontists in these parts of the world, but they do things very differently than we do here in Western society. So, in these communities, they breastfeed for years, sometimes 4 to 5 years. They are eating nuts and vegetables and fruit. They are not eating processed baby foods. So they're getting that muscle stimulation that then grows the bony structures and alleviates the need for orthodontics or teeth extractions. And so this is very much a Western problem. There's a lot of anthropology studies that have been done. We're happy to pass some of that information on to anybody who wants more details on that. We'd love to tell the story, and we could talk all night long.
Yeah, once those other populations that don't follow our ways of life, once they got exposed to our Western society and changed their habits, it didn't take long for them to become us. So one of the populations that they were watching, the next generation, 50% of that population started to have crooked teeth and degenerative diseases. They no longer had those perfectly formed jaws like those from 400 years ago. Because of that, we know it's environmental, because we didn't have these issues back, hundreds of years ago, even just 100 years ago. And we know for a genetic mutation to really show up in half of a population, it takes thousands of years, whereas this was happening the next generation and then progressing worse each generation after that until it didn't take long for them to become Western society at that point.
It does continue to come back to the foods that our kids are exposed to. We just are afraid that they're going to choke or whatever, so we just never give them the chance to exercise those muscles of mastication, the muscles of your chewing, that in turn grow the upper face, that in turn grows the airway structures behind it. It really is a ripple down effect. And we just never give them a chance to start off. And it's a compromised situation from the start.
Thankfully, we're actually starting to change that a little bit.
Of course.
With baby-led weaning. We have a lot of breastfeeding coalition type organizations out there that are promoting these habits and these ways of life that they don't even know that this is what they're affecting our development. It's other health benefits that come from this. But once we kind of start to dive into it, we realize how much this actually affects our overall well-being.
Yeah.
So at least we're starting to move in the right direction, thankfully.
The other great thing we've learned is we can now wake up the genetics. We can wake up the stem cells that live in these structures, and we can regrow the face to its original plan, the original genetic map that is in all of us. It's not too late to wake that up and redevelop these facial structures. So, I was taught in dental school, you cannot expand an adult's maxilla or the upper jawbone. That is wrong. We've been doing that now for some practitioners have been doing that for 30 years. So we now have methods to redevelop these facial structures, which is great for adults and people of all ages.
And there's not really an age limitation. If you have stem cells, you have the ability to grow. Your body has the genetic map. It has the ability. We're just turning on the car for it to follow that map and let the body go where it wants to go, where it was supposed to go. Yeah. So we did talk a little bit about tongue ties, and we are talking a lot about our nutrition and breastfeeding, but tongue ties is a big aspect of that as well. It doesn't necessarily have to be a tongue tie, but the tongue is really important in terms of maintaining an airway. And with little kids, that 0 to 4 years old, the tongue is really important with the development of that upper jaw. It actually acts as a scaffold for that developing jaw. If that tongue is in the roof of the mouth, the dentition and your jaw will actually form around that shape of that tongue. And then it's actually pushing everything in an outward direction while the lips are holding everything back. But if you are tongue-tied, or you're a mouth breather because you can't breathe through your nose, or whatever reason why your tongue isn't in the roof of your mouth, then the only force acting on that jaw is those lips holding it back. And you're going to get that really high vaulted V-shaped arch that doesn't have room for the teeth. Instead of that nice U-shaped shallow palate that can fit the tongue, let that tongue stay up out of the airway. And it also creates enough room for teeth. And that's when you have that nice smile from those 400 years ago without intervention of extractions or braces.
So in dentistry, we have been treating sleep apnea for, decades. Up until recently, our only treatment choice was to change the position of the lower jaw, the mandible. And that was really all that a dental appliance can do. Unfortunately, most patients, the problem is in the maxilla. It's the upper jaw. And so the upper jaw is the bone that houses the upper teeth that actually is part of the lateral borders of the nose. It's also the palate, which is the floor of the nose and the roof of the mouth. So when you can actually change the shape of the maxilla, you can actually change the whole shape of the nose. You can open up nasal passages. You can improve deviated septums. And we've learned that most obstructive sleep apnea, really the cause of that is the root causes the underdeveloped maxilla. So it's really great to be able to change that structure. Dr. Guilleminault is the founder of sleep apnea. He was a professor at Stanford, and he's been telling us that for decades, that the problem is really the maxilla. And unfortunately, as dentists, we've been treating the mandible with mouth guards. And in some patients, we're very successful with that, but for many patients, that made them worse.
Dr. Guilleminault, he's really looked at the full spectrum of sleep apnea, and they have the surgical aspects where you can break the jaw and move it where it needs to go and put titanium plates and screws in there. But even up until his recent passing, he was teaching Dr. Zaghi, who's a pioneer in this field. He's an ENT sleep surgeon, and he was realizing that a lot of this, as we get that expansion and that growth of that maxilla, obviously it's creating more room for the tongue. And Dr. Guilleminault knew the function of the tongue as well, where if he saw somebody, he'd come into the room as they're doing a surgery consultation and say, "Oh, hey, I got an emergency. We have a kid here with a tongue tie." And the surgeons are like, "What?" Like, when, part of the issue is getting that tongue out of the airway, but if there's nowhere for that tongue to go, then that's when we're going to have more obstruction of that airway. And that's why development of that maxilla, building that garage big enough to park that car in there. So building the maxilla big enough to get that tongue in the right spot so it can keep an open airway when you're awake and when you're asleep.
The key to a lot of this treatment then is to first identify the parts of anatomy that are underdeveloped. And it wasn't until we had the development of digital X-rays, CT scans, and digital impressions that allows us to really target the deficient anatomy. That ability, as well as knowing what the potential is allowing us to really focus individually on that patient's needs. And that is the game breaker for this, because now we have developed a very special appliances called biomimetic appliances, which means you work with the patient's own biology. We're working with their genetic potential to actually grow the best airway that they can grow. Yes, it's help directed by the appliances and by myofunctional therapy, which is physical therapy for the tongue and for the lips and the mouth. But it's through these targeted anatomical structures that we are really focusing on that allows these changes to take place. And the changes are permanent. Once they're there, the body will accept those as normal, and that's where the magic happens.
That's what biomimetics essentially is mimicking our biology, mimicking our normal biology. And that's essentially what we're doing with this. That's what normal breathing is. If you're breathing through your mouth, it's pathological breathing. You're skipping an entire immune defense through your nose. And if you go from the normal breathing through your nose while you're laying on your back like this to, more of a mouth breathing, where you're kind of like Lee here, where he's like,
"Oh, I'm fine."
That's when everything falls back.
Never does.
And blocks your airway. And so
Never does.
kind of all starts from that mouth breathing aspect too. So that's what we're trying to establish with everything that we're doing here, is establish that nasal breathing, make it so your tongue can sit at the roof of the mouth and your mouth can stay closed. And that's essentially what our number one goal is.
Absolutely.
When we talk more about children, one of the big things that is a big problem today is ADD and ADHD. And I truly think that diagnosis will go away, hopefully in the next decade. I think there's enough research now that shows that is a misdiagnosis. And these kids are suffering from lack of sleep. These kids are so tired that their bodies they do not know how to function, and we've all seen our kids when they're tired, they get hyper. And those kids often, will just be hyper until they finally crash. But these poor children aren't getting that refreshing sleep. They're not getting that reset. They're not getting that growth hormone. They're not learning. We process our memory in deep sleep. So these kids, their short-term memory cannot work. So these kids are confused. They're tired. They go to school, and the medications that these children are put on are basically speed. So they are giving these children speed to bring them up from being so tired that they can actually sit still. Unfortunately, they still aren't learning. They're not behaving normally. So there's a lot of studies now that show that when you treat an ADD kid with sleep, their symptoms improve. And so you can't tell the difference between an ADD child and a sleep deprived child. Their symptoms are exactly the same. If you want to learn more about ADD or bedwetting for your child, we are happy to have that discussion with you. We have lots of research, we have lots of resources for parents, so please ask.
And there's a lot of parents that are struggling with their kids not sleeping. I have an 8-month-old and a 3-year-old as well. And so my mom obviously has a lot of mom friends too, and it's not uncommon. It's pretty common when parents are struggling with sleeping of their children, whether they're waking up or can't get to sleep or wetting the bed or snoring. There's so many different symptoms that can affect that just wear out the parents too. So if the kid's not sleeping, guarantee you the parents aren't sleeping, and I can vouch for that personally.
It adds to the whole stress of the whole family dynamic.
Yeah.
It's amazing how it comes down to just very poor sleep habits, not being able to sleep well.
So you can click on the link below to see Matthew Walker's video on why we sleep, and that's going to go into a lot of the details that happens with sleep apnea and insufficient sleep, and it's extremely eye-opening. Based off of that development that we're talking about, one really good video that can summarize everything we've talked about with tongue posture and development early on in life is this righttogrowvideo.org that's down below, that can summarize everything that we've said in a more succinct manner.
As we go back to what we talked about with targeted anatomy, I like to make this analogy with patients that if you have a broken leg, there's nothing magical about the cast that makes the leg heal. It puts the leg in an environment that their potential healing properties just literally take place. So your body grows new bone. What we do with our appliances is we target anatomy, and it might be a symptom of TMJ pain or pressure pain of the sinuses. It might be all these different things where basically there's just not enough room up there for all those structures to work effectively. This 3D printed image is of the patient before Vivos treatment and then 10 months after Vivos treatment. The age of this patient is 59 years old. So this is not a child. This is somebody that came with symptoms that it was all related to the size of the airway.
This is a very simplified version of what a appliance looks like. This is an upper appliance for the upper jaw. It has some springs, it has some expansion screws. The acrylic is clear and quite light and durable. This is an appliance that can be customized depending on what the patient needs. It's got a lot of attributes to it, some springs, some expansion screws, so we can really develop a lot of different ways of the arch depending on what a patient needs. They're quite comfortable. Our patients really wear these very well. We have very few problems with compliance. One of the first things, I am a patient, I'm wearing a device like this. I would say one of the first symptoms I hear from a lot of my patients is I can breathe through my nose for the first time in my life. And I can honestly say that has been my experience with my appliance.
And to stem off of that, a lot of patients come in to, because of snoring issues, whether their spouse kicked them out of the bedroom or whatnot, and that's kind of where I started my treatment as well. So believe it or not, I actually got diagnosed with moderate sleep apnea, even though I look like I'm 12.
Mm-hmm.
But I act 13, so it's mature for my age. But but really, I got diagnosed with moderate sleep apnea at the age of 29, and I've been snoring most of my life, according to my wife. I also, according to my wife, I stopped snoring after about five weeks of treatment. Which is, a huge positive, and we've had plenty of patients who've stopped their snoring in that first week. It's not just a one-off either. We have quite a few patients that we can do that really quickly and get them, some relief of some of their main concerns and symptoms.
The encouraging thing and the aspect of this that is so exciting for us is that there are answers to these situations. There are methods and deliveries of being able to give you different exercises and very simple approaches to solving some of these very difficult problems. And I tell you what, this has been the most exciting thing I've ever been a part of in dentistry in 26 years. And it's always nice to, as a dentist, to make someone feel better or a tooth feels better, but to change somebody's quality and their quantity of life, boy, that's where it really, really gets exciting.
We have a great opportunity to work with our patients one-on-one. This is a team approach. We are here to be a part of your treatment. It's so exciting to be able to take a patient and cure a problem that they've had their whole life. And boy, when you change somebody's life, what a beautiful thing, to change a child's development to avoid some of these problems we talked about at the beginning is just one of the most joyful things I've been a part of in my career. So we look forward to answering more questions and talking with your families. We love what we're doing.
The exciting, this is so exciting because we're looking beyond teeth. We're not just doing a filling, and like they said, we're changing people's lives. And we started on ourselves. We started on our families. We started on our friends, because this is newer technology that a lot of people haven't heard of. And naturally, there's going to be some skeptics, and so us included. And so we treated ourselves and we treated our families, and we've seen some amazing results, which makes it so much, it makes it so much easier to be excited about this kind of a thing. Is when we're even seeing it in our own families and the improvements in our own circles.
So if there's any questions we can answer for you, we'd love to. We always offer free consultations for people that want to know more about what we're doing, but we really appreciate your time listening to what we had to say today.